country. I urge you to please continue to play this important role. History will not forget you for your effort by allowing God to positively use you to save lives. But like the proverbial Oliver Twist, Nigerians once or more, especially in the areas of commitments, dedication to duty, provision of the right care at the right time and at the right place, and doctor-patient relationship, which I believe gave birth to the theme of this summit. Permit me also to say, as a medical dental practitioner, that the theme patient-centered care is well articulated and unique, as it encourages patients to partner with their healthcare providers, and providers treat patients not only from a clinical perspective, but also from an emotional, mental, spiritual, social, and financial perspectives. Therefore, it encourages patients to have trust and personal relationship with their doctors. Distinguished ladies and gentlemen, indeed, as the acting head of the Civil Service of the Federation, I will not forget to use this opportunity to acquaint you on the Vision 2017-2020 of the Federal Civil Service Strategy and Implementation Plan, which has been approved by the Federal Executive Council with a focus to develop an efficient, productive, incorruptible, and citizen-centered culture in the Federal Civil Service. One of the key priorities of EPSI is improved welfare of civil servants. It is our hope that the successful implementation of an institutionalized rewards and recognition system, among others, will birth strategic outcomes such as a well-motivated, disciplined, skilled, and accountable civil service, leading to improved staff morale, efficient service delivery, improved productivity, and good governance. I therefore urge you to actively cue into the vision. It will serve as a motivational tool in order to bring out the best from the workforce under you. Finally, I congratulate the organizers and the entire Nigerian Medical Association family for the notable achievements and for your commitment and patriotism in contributing your own quota to the health sector at the highest level for this country. And thank you all, and may God bless you all. Thank you.
Your Excellencies, distinguished guests, ladies and gentlemen, that was the acting head of service of the Federation delivering a goodwill message at this summit. In the course of the goodwill messages, we had the entry into the auditorium of a special guest, indeed a special guest of honor, who is wearing two hats, a physician himself, is the Honorable Minister of Health, Dr. Osagie Ehanire, who is also standing in for the President, Commander-in-Chief of the Federal Republic. Ladies and gentlemen, let's welcome him. Now, we understand that we will continue with the goodwill messages and reserve, as part of our tailpiece engagements today, the statement from the Honorable Minister of Health, Dr. Osagie Ehanire, who is also, as I said earlier, standing in for the President, Commander-in-Chief. Next, to deliver a goodwill message, and as we indicated, please be very brief, is the Executive Secretary of the NHIS, that's the National Health Insurance Scheme, Professor M.N. Sambo, who is being represented by Dr. Emmanuel Uba. Dr. Uba, please, your goodwill message. If you can do it under 120 seconds, we'll appreciate that. Thank you very much.
Your Excellencies, distinguished guests, ladies and gentlemen, I will stand on the already established protocol. I bring you warm felicitations from the Executive Secretary of the National Health Insurance Scheme, who would have loved to be here today, but incidentally has other very serious engagements. NMA has identified topical and burning issues that will shape the future of healthcare to drive discussions at the summit. The focus of the main theme, patient-centered care, could not have come at a more auspicious time. Beyond traditionally designing health programs and channeling available resources to meet perceived needs, the health systems need to recognize the importance of the people they serve. It is important to respect their values, ensure they have adequate information and clear mechanisms for communication, improve access to health services, and proactively address potential health challenges. We also need to recognize that it is impossible to determine the quality of care without considering the perspective of the people who are the ultimate beneficiaries. We must therefore find ways to integrate them as essential stakeholders in the delivery of healthcare. We wish to congratulate the NMA executives, the local organizing committee, and indeed every member of the NMA for their unrelenting efforts in putting this summit together. We at the National Health Insurance Scheme are committed more than ever before to ensure that every Nigerian has access to quality healthcare service in Nigeria. Be assured of our support, and I wish you fruitful deliberations and a successful summit. Thank you.
Thank you very much for your goodwill message. Your Excellencies, very distinguished guests, ladies and gentlemen. Still taking goodwill messages from friends and Associate of Nigerian Medical Association. Your Excellencies, permit me to just recognize Chief Medical Directors here that are present, MDs here that are present of tertiary, federal, and state health facilities. It may be difficult to call you all by names at the same time. At times, permit me, we will recognize you specially as the program progresses. But however, permit me to recognize the one from my state, Dr. Osia Toma, Chief Medical Director, Federal Medical Center, Asaba. Please, can we give all of them a wonderful round of applause? I also want to quickly recognize distinguished Professor Roland Ndoma Egba, former Pro-Chancellor, OAU, Ife, a professor of surgery. Please give me a wonderful round of applause. And Professor J.C. Abiodun Ote Bayo, Chief Medical Director, University College Hospital, Ibadan. We celebrate all of you. Thank you very much. I'd like to, at this point, invite an amazing Amazon, a very unique woman, an obstetrician and gynecologist, an author of the Women's Health and Women's Health Advocate. He is representing Nigeria Association of Nigerians across Great Britain, MANSAC. Loretta Ogboro Oko. Please, can we give her a wonderful round of applause? Loretta Ogboro Oko, thank you very much. We appreciate you. Please, we just have maximum 2 minutes for all goodwill messages. We appeal to you. Thank you.
Thank you. Good afternoon, everybody. I stand on all existing protocol. My name is Loretta Oduware Ogboroko, and I bring you greetings from the United Kingdom. I've been a member of MANSAG, which is the Medical Association of Nigerians in Great Britain, for many years now, over the past 15 years. And I bring you tidings from the President and his crew, who happen to have been here in Nigeria only last month. However, before I proceed beyond this point, I want to crave all our indulgence and say that we all arise and give a 1-minute silence in respect of every single Nigerian patient and every single healthcare provider who has either lost their lives or been maimed by actions of commission or omission in our healthcare space. Can we please all rise? May the souls of all our fellow Nigerians rest in peace. It is very, very gladdening that there is light in the tunnel. Many of us in the diaspora are keen to come back home. Many of us in the diaspora go and excel because we are proudly Nigerians. The NHS in the United Kingdom will come to naught if the 7,000 Nigerian doctors and God knows the number of other healthcare professionals pull out of the NHS. We are keen to give back, and we are keen to be utilized to bridge the gap between what currently obtains in our environment and standard practice. So please, today let us all commend the Nigerian Medical Association under its current leadership, and let us all commend all of us here for what we are doing, every single healthcare provider. And please rest assured that the Medical Association of Nigerians in the Great Britain is happy to partner with us and continue to put our patients at the center of care. And we will do this for one reason and one reason only. The Nigerian patients are worth it. Thank you.
Thank you very much, Loretta Ogboro Oko. The Nigerian patients indeed are worth it. That's the theme for this year's summit. Thank you very much for reenacting it again in our minds. Next, we want to quickly invite Engineer Chika Okwolisa, CEO, Brain and Spine Foundation. Please, you have less than 120 seconds. So if I call minute, it will look as if it's big. It's seconds, 120, and it begins now. Thank you very much.
Good afternoon, my fellow potential patients. I'm here on behalf of Nigerian patients. I'm the founder and CEO of Brain and Spine Foundation. BSF is all about advocacy and health promotion regarding patients with brain and spine conditions in Nigeria and Africa. Within my family, my immediate family, we have been badly hit. My immediate younger sister sometime suffered a brain bleed, and she ended up having 5 brain surgeries. She survived 2 strokes and a seizure, and I was her caregiver, still her caregiver. So I'm in a position to talk and represent Nigerian patients. When I first heard of the theme for this health summit, I did not believe it was true. But when I discovered that it was actually true and it's going to happen, I was so extremely excited, and I began to promote it as if my life depends on it. And today it's real, it's happening. I want to say thank you to Nigerian Medical Association. This is a good step in a right direction. We need this badly, so badly in this nation. We can't continue talking, complaining, murmuring every time. It's a time to do the work. Every time I go to hospital, I walk around the world, my heart bleeds, my heart breaks. It's time to do the work. For you to decide to put your own welfare for the very first time at the backdrop and decided to put the patient, the Nigerian patient, at the front burner. It's a welcome development. On behalf of every Nigerian patient, on behalf of every potential patient, you and me, our families, our relatives, our wives, our husbands, our children, I want to say thank you for this summit. It's for us. It's about us. You have decided to start this movement. And I want to say that those that have been affected directly or indirectly by our poor healthcare system, plus carelessness, negligence, and selfish attitude of any healthcare professionals, we say thank you again. I just want us to do one thing for Nigerian patients. If I say patient-centered care, just let me hear Nigerian patients are worth it. Patient-centered care. Thank you and God bless.
All right, thank you very much. And we appreciate those who have already delivered their goodwill messages to this all-important summit and 25th Triennial Conference of the Commonwealth Medical Association. We are pressed for time now, and we still have quite a long list of persons who are willing to address this august gathering. But we will skip the remainder of the goodwill messages and go straight to one of the high points of this opening ceremony, which is a keynote address to be delivered by the face of the second National Health Summit. And to introduce our keynote speaker, let me humbly invite the chairman of the Abia State chapter of the Nigerian Medical Association, Dr. Ejiro Carol Iwoha, to let us know who the keynote speaker is.
Thank you. I count it a rare privilege and honor to welcome up to the podium His Excellency, Distinguished Senator Ifeanyi Okowa for his citation. His Excellency, Senator Ato Ifeanyi Okowa, was born on the 8th of July, 1959, in the Northeast Local Government area of Delta State. He had his early education in Ika East Local Government and his secondary school education at the famous Edo College, Benin City. He finished in 1976 and was the second best in the higher school certificate examination. The face of NMA NHS 2019 proceeded to the University of Ibadan, where he studied medicine and surgery and graduated in 1981 with MBBS at the record age of 22 years. Upon completion of the youth service, he worked briefly with the defunct Bendel State Hospital Management Board. He also had a private practice, Victory Medical Center, where he showed his philanthropic gestures to many. He's a man of many parts. Senator Dr. Ifeanyi Okowa, he rose up the political ladder. He was secretary of the Ika local government, chairman of the Ika North local government. He subsequently became commissioner of several ministries in the Delta State government until 2006, when he became the Honorary Commissioner for Health, Delta State, a position he held until 2007, when he became the secretary to the Delta State government. The love for him made his people elect him as the senator representing Delta North Senatorial District in 2011. It was a position he held distinguishedly and has been popularly elected by his people as the governor of Delta State in 2015. Since inauguration, Senator Okowa, by his leadership, vision, wisdom, and shared determination, has transformed the landscape of Delta State, thus earning rave reviews in the areas of infrastructure, secondary education, youth employment and empowerment, and sports development, among others. The face of NMA NHS 2019, distinguished Senator Ifeanyi Okowa, as a medical doctor, has made it's a litany of achievements for health system in Delta State, but permit me to mention a few. The state government launched the contributory health insurance scheme for Deltans, with the government paying for the under 5, pregnant women, and the elderly in the society. Since the establishment of the Delta State Contributory Health Commission, over 500 patients and counting have been registered for the contributory health insurance scheme. And he has built 63 secondary He has improved the functions of 63 secondary healthcare facilities, 110 primary healthcare facilities, as well as engagement of 52 standard private healthcare providers in the scheme. Beyond physical infrastructure in the hospitals, modern health equipment were procured, replaced, and rehabilitated to ensure use of appropriate technology. Emergency ambulance service have been relaunched to provide pre-hospital acute medical transport to different points of care. The Governor Okowa-led administration has successfully ensured the containment of various disease outbreaks within the state. He has constructed modern isolation ward at the Federal Medical Center Asaba. He has built manpower institutions of School of Nursing Agbo, Eku, and Wari, School of Health Technologies, Ofoma, and Delta State University Teaching Hospital, Delsut, Ogara. I told you the achievements are a litany, but standing before us is Dr. Okowa, a humanitarian and with philanthropic disposition. Over the years, he has endeared himself to his people. Dr. Ifeanyi Okowa displays highly developed craftsmanship in his approach to work and challenges, and this is evident in his constructive leadership and in his growing political profile. Ladies and gentlemen, distinguished guests in this event, join me to celebrate His Excellency, Senator Dr. Ifeanyi Okowa.
I hope I don't fall this. No, be careful. Your Excellency, the President of the Federal Republic of Nigeria, here represented by the Honorable Minister of Health, Dr. Sage Ehanire. Your Excellency, our father, the former head of state, General Yakubu Gowon, DCFR, who is not only a former head of state, but a great champion of malaria and the prayer warrior of this nation, who is the chairman of today's occasion. Very distinguished delegates to this conference. I would not want to recognize everybody because I've been strictly warned to keep away from the protocol and neither standing on the protocol, but I want to proudly respect it. First, I wish to express my appreciation to the President and executive members of the Nigerian Medical Association for the honor to address this gathering. I'm thankful and humbled by this special courtesy extended to me. I need to also commend the Nigerian Medical Association for its drive and passion to improve medical practice in the country for better patient care and health outcomes, as well as canvassing for standard operative environment for its members and other healthcare providers in line with global best practices. Over the years, the NMA has continued to impress with its robust advocacy, training, and development of its members, as well as engaging in corporate social responsibility through public enlightenment programs, especially with regards to communicable diseases. The vision of this National Health Summit is one that has the potential to shape and influence the national conversation on health system in Nigeria and serve as a catalyst for healthcare reform in our country. Whilst we have made little progress in the areas of increased budgetary provision for health, development of health infrastructure, improved life expectancy at birth, and training of healthcare professionals, the Nigerian health system is still far from what it should ordinarily be. It is currently a potpourri of problems such as inaccessibility to quality health care, inadequate health infrastructure, underfunding, dearth of skilled manpower, and still relatively high infant and maternal mortality rates. These are compounded by the absence of non-functional surveillance systems, the menace of fake drugs, poor sanitation and hygiene, as well as environmental degradation. In most cases, individuals and households are made to bear the brunt of a dysfunctional and inequitable health system, devoid of any social protection. They are compelled to either seek alternative healthcare services that may be unsafe or injurious, or pay out of pocket for healthcare services that are often beyond the reach of the common Nigerian. Patient-centered care, PCC, the theme of this summit, addresses a very vital aspect of healthcare management that is critical to delivering quality healthcare in Nigeria and ensuring the best possible outcomes and experiences for patients, carers, and families. I'll begin this discourse with an overview of the PCC model as a core strategy for improving the quality of healthcare in Nigeria. Next, I will examine the conditions that are germane to successful operation of patient-centered care in our health system. This will be followed with a brief examination of the current state of patient-centered care in Nigeria, after which I'll present a short case study that supports the concept of patient-centered care as a viable option to better health outcomes and patient satisfaction. Overview of patient-centered care as a primary approach to health care. Patient-centered care is a practice of caring for patients and their families in ways that are engaging, meaningful, and valuable to the individual patient. According to the Institute of Medicine, patient-centered care is providing care that is respectful of and responsive to individual patient preferences, needs, and values, ensuring that patient values guide all clinical decisions. The PICA Institute defines it as an approach to the planning, delivery, and evaluation of healthcare that is grounded in mutually beneficial partnerships among healthcare providers, patients, and families. Whatever the definition, the patient-centered care focuses on the patient's satisfaction and their perception of good quality as indicators of quality healthcare. The PCC model acknowledges that patients should actively participate in health-related decisions in a manner that inspires trust and confidence in the healthcare system. With enhanced patient satisfaction at its core, this approach to healthcare delivery is predicated on the premise that the family plays a vital role in ensuring the health and well-being of patients of all ages. According to the Australian Commission on Safety and Quality in Healthcare, person-centered care offers important potential to improve the value delivered by health services by achieving better outcomes at lower overall cost to health systems and the community. Globally, the PCC model is emerging as a key dimension to providing quality health care. Hence, enhancing the patient experiences and delivering patient-centered care is on the agenda of virtually every country today. With increasing knowledge and awareness amongst populations in developed countries, PCC is gaining grounds as a model of preferred care. It has taken center stage in discussions on quality health care as it promotes flexibility in healthcare provision and creates partnerships that are beneficial to the healthcare providers, patients, and their families. In a research conducted by PICA Institute and Harvard Medical School, 8 principles that drive patient-centered care were highlighted as follows. Respect for patients' preference, coordination and integration of care, information and education, physical comfort, emotional support, involvement and friends, continuity and transition, and access to care. In contrast to the more traditional medical care method, where the patient's role is passive and the patient is seen more as just a recipient of treatment, the patient-centered care model gives a voice to the patient, since the patient's role as an active partner in the treatment plan is not in doubt. Effective PCC plans, therefore, must be guided by the following. 1, aligning patients' needs and preferences to health systems' missions, plans, and values. Patients and family must have a voice in decision-making in the healthcare process and should be partners. 2, there is need for shared information and education of both patients and family. 3, care must be collaborative and coordinated as it leads to better health outcomes. 4thly, guaranteeing and driving the process of care to ensure physical comfort and emotional well-being of the patient in care delivery, and improve access to health care and disease prevention as it relates to both patients and the population, in our case, the communities that we live in. In fostering healthcare transformation, the patient-centered care model enhances the likeliness of patients adhering to treatment plans, trust in the healthcare system, and greater and better result outcomes in treatment plans. Key attributes of patient-centered care. The patient's journey in a patient-centered care model requires key attributes for achieving safe, high-quality health care while contributing to better outcomes and experiences for patients, carers, and families. 1, on information and communication. On the surface, information and communication appear to be one and the same thing, especially because they are often used interchangeably. But there is a slight difference. Information is passing across facts and figures. Communication is gaining understanding and eliciting goodwill. It is axiomatic that effective communication drives care and compassion in the patient-centered care model. It emphasizes the importance of understanding a patient's health history, the patient's goals, choices, expectations, fears, and anxieties, as well as their perception of what they consider quality health care. In addition, there must be sharing of information among the team of carers to foster cooperation, proper coordination, and synergy. Statistics indicate that 70% of litigations resulting from poor patient experiences and adverse outcomes is often due to poor communication. In such cases, patients felt they were misled, neglected in the decision-making process, and lacked proper understanding of the services provided, especially in the case of surgical procedures. Collaborative patient and family engagement. The Institute of Patient and Family-Centered Care has observed that without sustained patient-family participation on all aspects of policy, program development, and evaluation, the care system will fail to respond to the real needs and concerns of those it is intended to serve. To improve the experience of care and ensure quality and safety, the family is regarded as an equal member of the team. They are not left out in the design and implementation of the care plan. But even more importantly, family members are treated as respectable members of the team, not as visitors who cannot access certain areas of the hospital. Where this collaboration is in perfect alignment, it replaces doubt and suspicion with trust and confidence, inevitably resulting in the psychological well-being of the family, positive perceptions of the caregiver and hospital, and lower margin of system error, therefore reducing risk of conflict and litigation. Strong, well-structured teams for patient-centered care. The PCC model is a multi-dimensional and interdisciplinary approach to achieving quality healthcare outcomes at all levels of care. It uses an integrated approach to achieve quality healthcare delivery, utilizing service delivery processes where interprofessional relationships, teamwork, and what makes the patient satisfied are the motivating factors. Comprising the healthcare team is healthcare providers, the patients, and their families. The success of the team likely depends on complete, unbiased information sharing in a timely fashion, clear definition of roles, commitment to stated goals, and mutual respect for each other. Monitoring and evaluations. To achieve high-quality patient-centered care, there must be organizational commitment to continuous improvement focused on measuring patient outcomes and experiences. This must be clearly articulated in the organization's mission statement, and everything must be done to ensure buy-in by workers at all levels of the healthcare industry. The current state of patient-centered care in Nigeria. Literature on implementation of patient-centered care in Nigeria is scant. While the concept has been embraced as an imperative for providing quality health care, there are relatively few resources that give us insight on its operation and management in the Nigerian context. However, there are some factors that can be used to measure the extent the Nigerian healthcare system is compliant with patient-centered care. 1, interpersonal communication. Except for a few exemptions, most of our private and nearly all public healthcare institutions in Nigeria still practice the traditional medical care method in healthcare delivery. Here, the care is disease or illness-based. Symptoms and signs from patients are compiled and differential diagnosis made. The physician then goes ahead to initiate treatment and follow-up visits where necessary. There is hardly any communication as the patient and family play passive roles in the healthcare plan and, of course, in the implementation. When it comes to patient-centered care in Nigeria, many questions are begging for answers. And I think the chairman asked a lot of questions in the course of his speech. But some other questions are here to be answered. Are we prepared as a nation and as healthcare providers to embrace this transformational approach to healthcare delivery? Is the human resource available and adequate for this system of care? How accessible and affordable is healthcare to our growing population, most of who fall below the poverty line? More so when, as a nation, we are beginning to celebrate the numbers. Nigeria, almost 200 million. Nigeria, probably in the next 20, 30 years, will be the 4th largest nation in the world. Is that what we should celebrate or we should be celebrating the quality of life and the quality of human beings? As long as we begin and continue to celebrate the numbers without looking at the effects in a society where we don't have enough access to healthcare and in the indices are poor, and where there are educational problems and a lot of people are uneducated, then we are actually celebrating a very dangerous situation. Today, we're talking about insecurity in the land. A lot of it is traceable to the growing population that is largely unemployed, a growing population that is largely uneducated, and they do not have access to health care. And when you take out these two things, you have actually created pressure in the family. And the family is distorted. The children are not being brought up the way they ought to be brought up. And what then happens? They create other choices for themselves. And these choices are possibly not the best that we wish for our nation today. What is the percentage of Nigerians still paying out of pocket for health care? Is the healthcare provider warm or welcoming? Do the healthcare staff inspire trust and confidence in the ability of the health establishments to deliver quality health care, leading to patient satisfaction? These are many questions that we need to ask ourselves. Anyone who has lived in Nigeria long enough and has had to visit our hospitals have at one time or the other experienced the dismissive attitude of many of our healthcare providers. Some have acquired a notoriety for being harsh and unsympathetic to those they are meant to serve. Instead of regarding them as persons that need to be treated with respect and dignity, they tend to be perceived as burdensome. Also, do our doctors create the enabling environment and time to truly interact and adequately engage the patient? Is the patient allowed to tell his or her story, let alone allowing the family to participate in caregiving? Often, suggestions and opinions of the patient or relations are considered an affront and treated with resentment by doctors and other health staff. This shortcoming on the part of the doctor and other health staff leads to the perception that the system does not really care, except where it concerns the rich and powerful. Empathy is key on the part of the professionals in the healthcare industry to ensure the best patient experiences and expectations of quality service. Waiting times in our hospitals. It is not news that the wards and outpatient departments of our health institutions, especially the public hospitals, are overcrowded, leading not only to delays in service delivery, but sometimes to nosocomial infections. It is true that our health institutions are reeling under the pressure of underfunding, inadequate manpower, shortage of equipment, and population explosions. But it is also true that some of the delays experienced by patients in our hospitals are man-made. We must, as professionals, strive to provide the best care possible despite the challenges in our healthcare system. The doctor must show exemplary character needed to build trust among healthcare providers in order to provide the best available care and relationships with patients and their families. There is currently so much loss of confidence in our healthcare system that both the rich and poor are spending hard-earned money on overseas treatments for ailments that can adequately be attended to in our national health service system. Delayed services, system errors, and poor perceptions based on stories and frustrations out there has led to increasing patient dissatisfaction with our national health system. Universal health coverage. We may not be able to rapidly improve our healthcare system and health outcomes until we are able to that a greater percentage of Nigerians can access health care without having to pay out of pocket. 15 years down the road, we have had the National Health Insurance Act passed, and the scheme has been on for 15 years without an appreciable impact among our people. The enrollment numbers are low and limited more to the federal workforce. It is not the problem of the National Health Insurance Scheme. It's a collective problem of all of us. It's a collective problem of both the federal government, the states, and the local governments. We need to engage in serious advocacy, education. We need to communicate with our people to ensure that they truly buy into the health insurance policy of this nation and of the various states that have begun to now, in the last few years, engage in health insurance plans for the various states. Considering the high level of unemployment and poverty in the land, my honest view is that it is truly difficult to initiate a transformation to patient-centered care model when basic access to care and affordability is a challenge. However, all hope is not lost, especially in the primary care, as the National Health Act has enabled the introduction of the Basic Healthcare Provision Fund. Here we must appreciate the previous administration that signed the law in December 2014, and also the National Assembly that struggled to pull it through. I'm happy today because I led the committee at the Senate, and Honorable Ndudi Elumelu, who is seated here, the minority leader of the House of Representatives, was the chairman of the Health Committee in the House of Rep. And Dr. Nabulele and many other persons, I want to congratulate you on your elevation as President-elect of the CMA. Himself and his colleagues played a very major role with so many other Nigerians. And I must recognize our traditional ruler, who also played a very important role when we had the dialogues all through that period. Today, the Health Act has been passed, but I must also appreciate the president, the sitting president, who has decided to give voice to the Basic Healthcare Provision Fund, that we ended up capturing it in the budget of 2019 and also in the budget of 2018. It is something that we look forward to. We have started from the minimum because that act actually says a minimum of 1%. It's for us to continue to ensure that we utilize the funds rightly at the moment, and also ensure that we engage the state governments and the local governments to counterpart that fund, and therefore increasing the pool and ensure that we use the resources in the best interest, especially for the most vulnerable in our society. I believe that thereafter, NMA and others can lead the advocacy to ensure that we have an increment in that, because the Act actually stated not less than 1%. The implication of that is it could become 2%, it could become 3%, it could increase depending on the level of advocacy. The fund, if properly used and augmented by state governments, will increase access, affordability, and functionality of our health system, particularly at primary care level. It is heartwarming that many states are now beginning to embrace universal health coverage, with likely expansion to access and functionality of our health system. In Delta State, our Contributory Health Commission legislation was passed as early as February 2016. And since then, we have been able to start the operationality of the health insurance in January 2017. As of September 2019, we actually had a total of about 657,000 persons enrolled in the scheme. I thank God that the minister is here. I want to plead with Mr. Minister. You're doing a lot, but you may need to carry on with a lot of advocacy to my colleagues. Many persons may just start off a program because there is a need to start it. It may be because they want to access that fund that is available, that they are starting it. But I think that a clearer understanding, which we can only achieve by advocacy visit to the individual states, will actually bring out the commitment of the various chief executives of the state. And I think that it's important. And in such visits, I would also advise that you urge the governors to bring the local government council chairman to such advocacy visits so that everybody is brought on board. And I believe that in so doing, we are going to upscale the number of persons who are actually involved or participants in our various health plans in the country. Because before now, all we had done is to allow the Federal Civil Service into the healthcare insurance with a few others within the organized private sector. And that's why we have actually not done well as a nation. Some other nations, even within Africa, have been doing quite well. I believe that we can, now that we have the opportunity, we can truly drive the process. And I must appreciate NMA for bringing this whole thing to the discourse. Because when we are sure that our health systems are functional, when we are sure that they are equity plans, we can now begin to drive the processes more and more. And when we are no longer paying out of pocket, the functionality of the health system is no longer going to be questionable, because the health insurance on itself has to provide some level of funding that will increase the functionality of our various health institutions. And when we have such functionality improve, the likelihood is that doctors and other health staff will no longer be under intense pressures, and their services are likely going to be better. In such a process, you find that the relationship between the patient and the doctor, or the patient and the nurse, is going to be much warmer and much better. But when you're working under very difficult conditions and the patients don't have money to pay, and you don't have money to pay your staff, and you're expecting such doctors and nurses and other staff to be very friendly, you are not likely going to get the best of results. So we actually need to work very hard. Achieving patient-centered care, a case study. As previously stated, there is very little literature on the PCC model in Nigeria, despite overwhelming stakeholder opinion that it is good for the provision of safe, quality health care. But we can build an available literature from other clients to support the concept of PCC as a reliable medium to deliver patient satisfaction that can be measured. For an empirical case, I'll turn to the Armstrong Institute for Patient and Quality, Johns Hopkins Medicine, which surveyed responses of patients after discharge about their hospital experiences. Using data from hospital consumer assessment of healthcare providers and systems, a total of 3,000 hospitals were surveyed, and the research found several common approaches among successful companies as follows. I'm just going to give this case study for us to realize that if we're able to make an attempt to do some of those things, it may not be to the extent to which is done in this best case scenario of hospitals, but striving to do some of these things will better bring the relationship between us and our patients, and it will help us to improve the perceptions that our patients and families have about us. One, on hourly rounds. In these best case scenarios, nurses and other clinical staff members make rounds in the patient's room every hour to address pain, bathroom needs, and positioning, and to make sure that personal items are within reach. Communication and care boards in patient rooms. The boards list important information, such as new and existing medications, discharge goal, tests and procedures, and how to easily contact care providers. Bedside shift report. This is quite important. I loved it when I read about it. Nurses conduct reports at shift change in the presence of the patient and family, or the family rep, giving them the chance to ask questions, understand the care plan, and correct any inaccurate information. Discharge folder. On admission, patients receive a folder with a checklist of information they will need when they get home, such as the purpose of their medication and symptoms to look out for. Post-discharge phone calls. Thank God, many of our patients, many families now have phones. Nurses call patients within 2 to 3 days to check their status and answer questions about instructions and self-care. multidisciplinary rounds, involving all members of the care team, as well as patients and family in our various rounds. Standards of performance, creating standards for all employees to follow, such as quickly responding to patients in a friendly manner and how to respond to patients' concerns and complaints. In conclusion, in concluding this paper, I wish to state categorically that patient-centered care remains a viable option for us to improve the healthcare delivery system in Nigeria. It has great potentials to produce much better outcomes in cost-efficient manner, reduce system errors, and increase patient satisfaction that will radically alter the current unfavorable perception of our healthcare system by majority of the public. If we want to stop the medical tourism, I think that we need to begin to look very closely at our relationship with our patients, and obviously patient-centered care comes to the solution and to the rescue. While expansion to access and functionality of our health institutions is necessary, the greater need is a resolve by healthcare providers and teams to be more committed to their duties. We must do this with some reasonable level of integrity, ensuring that the voice of the patient and family is not silenced in the course of our relationship. In consonance with the physician's pledge, and I thank God that we all took that oath again today. In consonance with our physician's pledge, our patients ought to be respected and treated fairly. Saving lives is not just the cure of an ailment, but the total well-being of the patient, who must be a friend and partner in the healthcare process. Even more compelling is the need for a clear strategy and the establishment of patient-centered governance systems, where patient-centered care is the business of everybody in the organization. The structure must be such that encourages the participation of all, while enabling the patient to fully share in the decision-making process. The PCC model is enhanced when roles of team members are clearly spelled out in a way that is empowering and invites accountability. Accountability not in terms of money, but accountability in terms of doing what we ought to do, and the patient and family doing what they ought to do. A partnership that can be trusted, a partnership that breeds confidence. Finally, the following statement by the late American civil rights activist, Maya Angelou, in my considered view, speaks to the very heart of patient-centered care. And in quote, "I have learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel. The Nigerian patient, if you treat him well, if you create a partnership that is enduring, will not forget the good that you have done. But when we treat them as if they are just a burden to us or a burden to the nation, even the very poor amongst them will start to look for funds to go overseas, or they may have to look for alternate ways of treating themselves, which will not be in their best interest. It is on this note that I wish you fruitful deliberations at this summit and look forward to receiving your recommendations in the days and weeks ahead. And I hope that the recommendations that come out of this place will be communicated to the Ministry of Health and from the Federal Ministry of Health to every state government and to every local government, because we now require a true partnership between the leaders in governments and the leaders in the healthcare system. And it's important that this partnership will work. And all of us must realize that collaboratively we must work with our patients and Nigerian people to ensure that the best of care is provided for them. God bless you.
That was His Excellency Governor Ifeanyi Okowa of Delta State giving his keynote address where he dwelt extensively on patient-centered care. That's the theme of this summit. And of course, as you already know, Governor Okowa is the face of the 2019 National Health Summit. It's a governor, many had said, had really done well in terms of service delivery and worthy of emulation by other state governors, particularly when it comes to health care delivery. He had been able to take us through the concept of patient-centered care, what it entails, and how it impacts on improving the Nigerian health indices, interprofessional relationship in the health sector, universal health coverage, and of course reversing medical tourism. So much has been said about the attitude of health workers and as they affect the patient. So listening to Governor Okowa at this summit, a whole lot of poses he threw up, just like the previous speakers, like His Excellency, former Head of State, General Yakubu Gowon, who is also the chairman of the occasion. He too had threw some poses which had to do with the fact that there must be a paradigm shift in the way things are done currently. And of course, as you know, the National Health Summit, the first edition, took place in Asaba Delta State in 2013, and a whole lot of good things, followed that summit. So it's about walking the talk, and there's a whole lot of great expectation where this second edition holding in Abuja is concerned.
Professor Vajira Disanayake, outgoing president of the Commonwealth Medical Association, and he is from Sri Lanka, formerly known as Ceylon. I'm sure if you drink tea, you would know that Ceylon, they have very good tea. Mr. President, we also have very good tea here in Nigeria from the highlands of Taraba. Mr. President.
Good afternoon, everybody. His Excellency, the President of the Republic of Nigeria, represented by the Minister of Health, the Federal Minister of Health himself, the former head of government, federal leadership of the Nigerian government represented here this afternoon, regional leadership of the Nigerian government represented here this afternoon, President, Executive, the local conference organizing committee of the Nigerian Medical Association, my colleagues in the Commonwealth Association, Nigerian medical professionals, distinguished invitees, ladies and gentlemen. It gives me great pleasure to address you this afternoon as the outgoing president of the Commonwealth Medical Association. All of us in the Commonwealth are brought together by one vision. That is the vision for making the health and well-being of the citizens of our countries, which make 1/3 of the world population better. That shared vision has no bounds. It cuts across the world, from Canada to New Zealand, crossing many parts of the world, from the rich to the poor, and even to the very destitute. There is a lot that's got to be done to make the life of Commonwealth citizens better. Today, from the morning, I was listening to various talks given by the leadership in terms of the political leadership as well as the medical leadership of Nigeria. Now, the issues that were brought up are similar to the issues that come up everywhere across the Commonwealth. Why I say that is because these issues are not unique. There are parts of our world where they have been tackled and tackled effectively. And we have to share those shared experiences and learn from each other and go forward. That is why organizations such as the Commonwealth Medical Association exist. That is the forum where we learn from each other. And so, as the Nigerian Medical Association takes the leadership in the Commonwealth Medical Association, that is an opportunity for the Nigerian Medical Association to bring together professionals in the medical profession across the Commonwealth so that we can learn from each other. And I hope that the Nigerian Medical Association in the coming 3 years would make use of that opportunity and show the leadership and take leadership of the Commonwealth Medical Association proactively to contribute to the rest of the Commonwealth as well as to learn from the rest of the Commonwealth. What does it mean? I was just sitting there and thinking, reflecting on my own experience during the past 3 years and reflecting on what it would mean to Dr. Osahan Enabule as he takes on the presidency of the Commonwealth Medical Association. Ladies and gentlemen, the presidency of the Commonwealth Medical Association, I would say, is a powerful position. It's a powerful position because of several reasons. It, in a way, makes you the chief medical diplomat for the Commonwealth. Health diplomacy is a subject which is rarely talked about, but it is a powerful tool and we should make use of it effectively. Once you become the president of the Commonwealth Medical Association, you get the opportunity to get the attention of the Commonwealth Secretariat. What that means is that you get the attention of the Commonwealth health ministers, because many people do not recognize the fact that the Commonwealth health ministers are the only health ministerial group in the world that meets every year. They meet every year in Geneva. They come together as a group. The deliberations that they make go to the World Health Assembly and shape the World Health Agenda, as it were. So, as the president of the Commonwealth Medical Association, with the backing of the entire Commonwealth behind you, you are in a position to influence the health minister's agenda, the deliberations that go on in the World Health Assembly, and so on. And it is important. During my presidency, that is one of the things that I did. We articulated what was called a Commonwealth Digital Health Initiative. Why digital health is seen as a tool that would reshape the way we deliver healthcare. We were able to, in 2016, have the first Commonwealth Digital Health Conference when I took over as the president of the Commonwealth Medical Association in Colombo, Sri Lanka. We repeated that twice over, and next year we would be having the fourth Commonwealth Digital Health Conference. Now, along the way, we were able to reshape the thinking on digital health, first with a Commonwealth policy brief on digital health that was adopted by the Commonwealth Health Ministers at their meeting in 2017 in Geneva. That fed in to the World Health Assembly resolution on digital health in 2018. And therefore, because of that leadership role that the Commonwealth Medical Association took in digital health, we are now recognized as a leading force in digital health throughout the world. Nigeria could benefit from that. And this afternoon, I am going to give a talk on how the Commonwealth Digital Health Initiative is shaped. How can Nigeria benefit? Firstly, today, all the international development agencies are lining up to create what we call digital health leaders. In fact, today itself, there is a summit of all the international donors happening in London to determine how to fund that initiative. I'm unable to be there today because of this very important event happening here. But we are represented at that meeting through the Commonwealth Center for Digital Health, and the alignment that we make with the international development partners could be brought to not only Nigeria but to all other Commonwealth countries. Therefore, all Commonwealth countries would benefit from our initiative in creating digital health leaders. The second aspect is, in terms of how Nigeria could benefit, is in the form of innovation in the healthcare sector. What we call frugal digital innovation. Low cost, highly effective, scalable, implementable, interoperable, Ministry of Health owned and developed solutions. When I say those words, you may wonder whether it can be done. There are many examples from around the Commonwealth where it has been done. And we are, as the Commonwealth Medical Association, the Commonwealth Digital Health Initiative, and the Commonwealth Digital Health Center, we are in the process of helping governments set up their own innovation centers. And I would like to request the Minister of Health, who is here today, that I'm praising him of this development through this talk. Let's see how we can join hands so that we could have an innovation center sitting here in Abuja, which is connected to the rest of the Commonwealth, which is benefiting from the rest of the Commonwealth's developments. So that's the second way in which Nigeria could benefit from the Commonwealth Digital Health Initiative. Under the leadership of Dr. Inabule, we are looking at playing a more proactive role in universal health coverage, taking universal health care and implementing it. So that is the next stage that we are moving on to with the establishment of, with the installation of Dr. Inabule in a few more minutes. And we hope that the next stage of the work that we do would be taken to a different level with his leadership. And I'm sure that the support that we have seen in this conference from the federal as well as the regional governments of Nigeria for the initiatives of the Nigerian Medical Association, and the positive outlook that we have seen for the presidency of Dr. Inabule in the Commonwealth Medical Association would enable the scaling up of what we have been doing in the Commonwealth Medical Association and would take the Commonwealth Medical Associations to greater heights. So with those words, let me congratulate the incoming president as well as the Nigerian Medical Association for so willingly taking up the leadership of the Commonwealth Medical Association. And we as members of different medical associations from around the Commonwealth would give our fullest support to the Nigerian Medical Association in the coming 3 years. Finally, I would like to thank all of you for the very generous hospitality that you have extended to all of us. Thank you very much.
Thank you very much.
It is worthy to mention that Nigeria is hosting for the first time the 25th Triennial Delegates Conference of the Commonwealth Medical Association with the theme Fast-Tracking the Attainment of Universal Health Coverage in the Commonwealth. The high point of that event will be the investiture of Dr. Osahon Enabulele as the new president of the Commonwealth Medical Association. And that makes him the fourth Nigerian to head the Commonwealth Medical Association. It's also interesting to know that Dr. Enabulele was the NMA president in 2013 when the maiden edition of this National Health Summit was held in Asaba. Some of the goodies that came out of that was the enactment of the National Health Act, the Basic Health Provision Health Fund, which Nigeria is already enjoying today. So we have great hope that with him occupying that post, that we have better days ahead for the Commonwealth, especially the fact that he is one of us, all Nigerian, whom we are really proud of.
Mrs. Juan Enabulele. We also like to recognize the brother-in-law, Mr. Osamu Idahosa. We celebrate you. And of course, Mrs. Efe Idahosa, you are recognized. Please give them a wonderful round of applause.
Like I said earlier on, Dr. Osahon Enabulele was the NMA president in 2013 when the maiden edition of this National Health Summit was held in Asaba, the Delta State capital. And now he's going to assume the mantle of leadership of the Commonwealth Medical Association as the first Nigerian to occupy that position. And from his track record, we know that it could just be better days ahead for the Commonwealth in terms of healthcare delivery. So we're expecting that resolutions from this second edition of the National Health Summit of the NMA will come up with things that will lead to paradigm shift in the way things are done.
The National Officers Committee for this remarkable feat of hosting the second National Health Summit of the Nigerian Medical Association. I also want to especially thank the President-elect of the Commonwealth Medical Association and the members of the local organizing committee for this privilege and honor of being invited to present the citation of our mentor, role model, born leader, and indeed the world's finest, Dr. Osahon Enabulele. A strategic thinker, writer, public affairs and policy analyst, socio-political commentator, civil and human rights activist, and a health advocate of global renown. He was born on the 29th of January 1971 to the family of Elder Jonathan and evangelist Mrs. Rachel Enabulele in Uselu-Ego local government area of Edo State. Dr. Sir Enabulele early in his childhood exhibited all the signs that he was a star, whose luminosity was bound to glow brighter. He was widely recognized by his teachers and peers for his prodigious talents, leadership, and excellence, which were qualities that are natural to Osaon. At Victory Primary School, where he started his education, he served as a class captain for many years, while still serving as a patrol leader of the Boy Scout movement. With exceptional brilliance, indomitable will, good leadership qualities, diligence, and dedication, he became the poster child for leadership and academic success at the Federal Government College, Wukari in Taraba State, where he had his secondary education. And there he won a lot of laurels, including being the first overall academic class performance between 1984 and 1985. He was also the best in chemistry, economics, and mathematics in the same academic session. And while in school, he won numerous awards. And being a gifted child, he graduated with 6 distinctions from secondary school. Upon completion of his secondary education, Dr. Enabulele proceeded to study medicine at the School of Medicine, University of Benin, from where he earned his Bachelor of Medicine, Bachelor of Surgery, MBBS degree. And later on, he did his internship at the University of Benin Teaching Hospital and proceeded to do his youth service at the Comprehensive Health Center, he called a Fion Otobokoyon in the Dukpani local government area. Because of his love for education and to broaden his professional horizon, he also earned a master's degree in health planning and management in the year 2001 and the fellowship of the West African College of Physicians, Faculty of Medicine in 2007. During his residency training period, Dr. Enabulele played a major role in the revitalization of the Association of Resident Doctors UBTH chapter in the year 2000 to 2001, and this period was a period the association was almost collapsing. He was known for his fearlessness, independence, patriotic, and unbiased depositions on all the matters brought up for deliberations by the association, earning him the Presidential Merit Award of the National Association of Resident Doctors on the 24th of September 2005. Between the 2nd of August 2008 and July 1st, 2010, Dr. Enabulele served as the chairman of Edo State branch of the Nigerian Medical Association and executed his agenda for action on positive transformation of Edo State branch of NMA, which helped to greatly reposition the branch. He led the association to reverse the obnoxious private hospital charges imposed by the then Edo State government. Dr. Enabulele dutifully served the Nigerian Medical Association in several capacities spanning from 2002 up to when he was elected as the second vice president of the Nigerian Medical Association in 2004, thus becoming the first junior doctor / resident doctor in Nigeria to be elected into the presidency of the Nigerian Medical Association. As the second vice president of the NMA, Dr. Enabulele was pivotal to the drafting of the bill seeking for the establishment of the Office of the Surgeon General of Nigeria. In the year 2012, Dr. Enabulele was overwhelmingly elected as the president of the Nigerian Medical Association, NMA, a position in which he served from May 4, 2012 to May 3, 2014. He is thus the youngest ever president of the Nigerian Medical Association at the age of 41. Dr. Enabulele is the chairman of the National Disciplinary Committee of the Nigerian Medical Association from 2016 to date. Dr. Enabulele's tenure as president of NMA brought a lot of vibrancy and visibility to the association with the achievements of several feats, among which are the hosting of the first West African regional meeting of the World Medical Association, anchored and chaired by the then president of the World Medical Association, Dr. Margaret Mungerera, and the convocation of the all-embracing and historic first NMA National Health Summit, which was successfully held in Asaba, Delta State of Nigeria in 2013. Dr. Enabulele is a member of the Executive Committee of the World Medical Association, the first Nigerian to ever sit on the Executive Committee of the World Medical Association. He's also the chairman, Social Medical Affairs Committee of the World Medical Association, and also the first Nigerian to ever be elected as the committee chair. Dr. Enabulele was yesterday elected as the president of the Commonwealth Medical Association and will be installed in the next few hours. Dr. Enabulele is not a prophet without honor at home. He has been reckoned on by the government to serve on the boards of several institutions. On account of his previous excellent services, Dr. Nabulele was reappointed by the federal government of Nigeria to serve as a member of the board of management of the Lagos University Teaching Hospital from 2018 to date. He was also a delegate of the 2014 National Conference. He has been decorated with over 50 awards and honors from various organizations. Dr. Osai Nabulele is happily married to his lovely wife, Dr. Mrs. Joanne Inabulele, a consultant restorative dentist and senior lecturer at the Department of Restorative Dentistry, University of Benin, and blessed with 3 beautiful children. He is a humanitarian. He writes a lot. He loves to show political discourse, and he enjoys traveling. Distinguished ladies and gentlemen, with all due respect, I want to present to you the first Nigerian to be elected as the president of the Commonwealth Medical Association, Dr. Osahon Enabulele. Please, let's rise on our feet. Congratulations, sir.
Congratulations indeed. Thank you so much, Your Excellencies, ladies and gentlemen, as we invite Professor Vajira Disanayanke from Sri Lanka to inaugurate the 25th president of the Commonwealth Medical Association.
And to be accompanied by other presidents of the Commonwealth Medical Association. Other presidents here, please, that are present, can you please join the Commonwealth president, please? Please give them a wonderful round of applause.
Please, may I invite my mother to please come on stage, my wife, and of course, my family members and all other guests who came with me. Please come on stage. Thank you.
Your Excellencies, ladies and gentlemen, it is now time to inaugurate Dr. Osahon Enabulele by the President of the Commonwealth Medical Association, distinguished Professor Vajira. And of course, everybody is here. The Enabulele family, the mother, and all the presidents, including the president of the Nigerian Medical Association. A very distinguished chairman of the occasion is also here. Ladies and gentlemen, this is the moment. This is the moment. A round of applause. Congratulations, Nigerian. Congratulations, Nigeria.
A historic moment. A historic moment indeed for over 57 years. This is the first time a Nigerian medical doctor is becoming the president of the Commonwealth Medical Association. Dr. Osahon Enabulele, the lion killer.
The Godomikodo. All right, shortly he's going to give his acceptance speech, and we'll take it up from there. Congratulations, Nigerian Medical Association. All right, ladies and gentlemen, we want to respectfully ask us to descend. We have time for photograph. Please kindly just return to your seats to save time. Please kindly return to your seats now. Congratulations, Dr. Osahon Enabulele. Please can we descend and return back to our seats? And let's leave the man of the moment on stage. Former President, Nigerian Medical Association, and now the President of the Commonwealth Medical Association. I will say a big thank you to Dr. Vijira. It is not easy to relinquish power, but today you've done that. Congratulations to you, a growth professional. Over to you, sir.
Yeah, Abby, don't worry. I'll stand on non-existing protocol. It's okay. No, this is an address. Thank you very much. This is a very emotional moment for me. And I want to say that I respect all the protocols. Importantly, the presence of our former head of state and chairman of today's occasion, and the president of our country, the president of the Republic of Nigeria, ably represented by our dear minister, who is doing so much to give some very quality improvements in the healthcare environment, and other excellencies here present. Importantly, the governor of Delta State and Nasarawa and all other dignitaries here present. Please permit me to recognize the president of the NMA who has made this possible, and the president, the outgoing president of the CMA, and other dignitaries from the National Medical Associations of the Commonwealth. May I respectfully stand on other protocol already established. On behalf of the newly elected CMA Executive Committee, I want to specially thank all of you for making this a historic reality. I honestly, like I said, am a bit emotional about this because it's taken us so many years of engagement. And to see this happening live and in our time is something that I'm sure we'll all relish for a very long time. But let me read my prepared speech for you because that is a tradition. And I want to crave your indulgence to allow me to do this. Respected dignitaries here present, I truly realize that an occasion of this nature cannot but evoke some mixed feelings, considering the totally unique and unprecedented events that culminated in today's historic reality. This is more so in recognition of the fact that despite the participation of the NMA in the affairs of the CMA over the decades, this is the very first time that a Nigerian physician, and indeed the Nigerian Medical Association, will be given the opportunity to lead the CMA since the association was formally vetted about 57 years ago. I therefore want to say I stand here in appreciation as the 25th president of the Commonwealth Medical Association, and I thank you all for that. I want to particularly thank the outgoing leadership of Professor Vajira, Dina Sayaki, and other CMA leaders for believing in the ability of Nigeria to effectively pilot the affairs of the CMA. I greatly recognize that a lot of factors were taken into consideration by the Commonwealth Medical Association before investing this trust in us. I therefore wish to use this opportunity to affirm that this huge trust that has been invested in us and the new CMA executive will under no circumstance be betrayed. I'm grateful to the President of the Federal Republic of Nigeria, President Muhammadu Buhari, GCFR, for creating the enabling climate for the hosting of this 25th Commonwealth Medical Association Triennial Conference. Indeed, a lot of the delegates, aside from one or two, had very easy movements into Nigeria. And that tells a lot about our foreign policy. So I want to thank Mr. President for creating this enabling environment. And importantly, I also want to appreciate our Minister of Health, a man that has so much to give to the health sector, Dr. Osage Ehanire, and indeed is the Minister of State for Health, who has been very supportive as well, Dr. Honorable Mamora, for their support. We eagerly look forward to working synergistically with the Federal Ministry of Health and other development partners across the Commonwealth to advance the ideals and objectives of the Commonwealth Medical Association. I'm grateful to the Governor of Delta State, His Excellency Senator Ifeanyi Okowa, and other governors and dignitaries here present who supported this conference in one way or the other. I also want to put on record my appreciation to my governor, the governor of Edo State, who is unable to be here today, although he had committed himself towards making this movement to Abuja. But I want to put on record my firm appreciation for all the encouragement and support from the governor, who is doing his best to uplift the standards and quality in Edo State, Mr. Godwin Nogegase Obaseki. My profound gratitude to all national medical associations, some of whom have gathered in Abuja today from Malaysia, from Cameroon, from India, from Kenya, and some other places. All right. But I must thank them, because without their support, it would not have been possible. My profound gratitude also, and I need to place this on record, because of the history and the struggle that characterized all of this in the last 14 years. I want to pay particular homage to the current president of the Nigerian Medical Association. Please stand up for recognition, Dr. Francis Adedayo Fadiyule, and his executive for believing in me and supporting my humble bid to steer the affairs of the CMA as its president. Mr. President, may God reward you and reward you abundantly. With a mandate given to us, one that embodies and signals the concrete resolve of the CMA to actualize the dream and vision of transforming health systems across the Commonwealth, I wish to declare the readiness of members of the newly constituted executive to truly pilot CMA to greater heights. I pledge that our fervor and passion to positively drive the engine of growth and progress in CMA is total. As we settle down to excogitate the details of how we intend to get a collective agenda off the launchpad, we wish to state that the philosophy of our executive will be totally hinged on the broad policy objectives of the Commonwealth Medical Association, particularly as it concerns making needed contributions to the positive transformation of health systems across the Commonwealth, particularly in the low and medium income countries, and indeed the developing countries of Africa. We shall also strengthen the health rights, make our contributions to the strengthening of the health rights of citizens across the Commonwealth, and improving the social climate and working conditions of physicians and other health professionals in the Commonwealth to exercise their sacred duties and responsibilities. We shall give utmost importance to the issue of universal health coverage. And indeed, the theme of my presidency is centered on fast-tracking universal health coverage. We shall bring on board several initiatives to propel this across the Commonwealth. And this we shall do through a very thorough analytical framework that, of course, will result in introduction of some social health initiatives unique to the Commonwealth. And we hope that through this and other initiatives, we'll be able to fast-track the attainment of universal health coverage. We also want to give a platform to physicians and other stakeholders across the Commonwealth through the CMA to have a voice, to make contributions to our quest to advance healthcare systems in the Commonwealth. As a matter of importance, we shall establish a Young Doctors Forum in the Commonwealth Medical Association to enable the young physicians across the Commonwealth to have a voice and to contribute their ideas towards moving the Commonwealth forward. According to the World Health Organization, despite recorded progress in countries in all regions of the world, millions of people still have no access at all to healthcare, and millions more are forced to choose between healthcare and other daily expenses, such as food, clothing, and even a home. This situation is even worse in some countries of the Commonwealth, particularly countries in the African region. It is a realization of this that we shall work with governments across the Commonwealth to strengthen healthcare systems, particularly at the primary healthcare level. We shall also contribute some innovative health schemes, and of course, promote our digital health initiative, which the outgoing president elaborately talked about. We shall also work on the issue of clinical governance and institution of quality assurance systems in our healthcare systems. Let me also say that one cardinal program that will be pursued in my presidency will be the issue of institutionalization of what we call a CMA, Safe Hospital Initiative. We need to make our hospitals safe for the providers of care to continue to promote and undertake their God-given responsibilities. And so the issue of physician and health workforce violence against the physician and health workforce will of course be given some needed attention to ensure that we have some semblance of sanity within healthcare systems across Africa. We believe that this and many more other initiatives will help to also advance the attainment of the SDG 2030 agenda, particularly as it concerns universal health coverage. Because of time, I will just say in conclusion that during my presidency, we shall ensure that all disadvantaged communities within the Commonwealth have a place of pride in our affairs. The voices of those who are in disadvantaged conditions and environments must be given some needed attention. It is not all about the big players, but even those who are resource challenged, we must necessarily give them a voice. And so as we journey through the second decade of the 21st century, I wish to call for total support of all in the critical address of the several challenges that face us individually and collectively in the Commonwealth. I hope and I pray that we can build foundations of greatness. For we, as an executive, we are prepared to do the much we can to ensure that solid foundations are built and that the CMA and indeed health systems in the Commonwealth are taken to a new direction. We shall institute a CMA Excellence Award, which will, of course, incorporate the ranking of health systems in the Commonwealth and, of course, accord healthcare workers, physicians, the needed recognition and rewards for all they are doing. On that note, and because of time, let me once again appreciate the local organizing committee, the Dr. Ekwe Uche-led local organizing committee, and indeed the Ofem Enang-led central planning committee for all the efforts that they have made in putting this together. I recognize your sleepless nights, the sacrifices, your toil and moil. May God reward you. Let me therefore also thank all those who have come from all the length and breadth of Nigeria to solidarize with me and my executive. They have come from all places, and for want of time, I may not be able to call all of them, but they are here in their legion. The former Inspector General of Police, Solomon Arase, you are welcome. Honorable Samuel Ojo, the Chairman, Loot Board of Management, the CMD University of Benin Teaching Hospital, the members of the Liberation Party of Nigeria. There are several of them who have come. Comrade Austin Osakwe of the Foundation of Good Governance and Social Change. I recognize all of you, and indeed the Lion Killers. Lion Killers, I'm proud of you. I thank you for all what you have done, and together we are going to make this dream realizable. On that note, therefore, let me thank you and hope that we can lift the Commonwealth to a new level. I thank you, and may God bless us all. May God bless Nigerian Medical Association. May God bless Nigeria. May God bless Africa. And may God bless the Commonwealth. Thank you very much.
All right. Once again, let's appreciate the new president of the Commonwealth Medical Association, Dr. Osahon Enabulele, for his acceptance speech and the bold initiatives that he has outlined for the course of his tenure as president of the CMA. Once again, Dr. Osahon Enabulele, thank you very much. His nickname is Igodomi Godo. For those who do not know, that was one of the ancient names of the Benin Kingdom, Igodomi Godo. I'm sure you also know the king of political bombast in Nigeria, Honorable Patrick Obahiagmo, aka Igodomi Godo. So there could be some similarities between Dr. Enabulele and Honorable Patrick Obahiagmo. If we had left him here at the lectern, perhaps it might still have been on. Congratulations to Dr. Enabulele and indeed to all the physicians here present. We now approach another high point of today's ceremony, being the opening of the summit. And it's my pleasure and indeed respect to humbly invite the special guest of honor to deliver his remarks. And the special guest of honor is His Excellency President Muhammadu Buhari, Commander-in-Chief of the Armed Forces of the Federal Republic, here ably represented by the Honorable Minister of Health, Dr. Osagie Ehanire. Dr. Ehanire, representing Mr. President.
Your Excellency, the former head of state, the most senior former head of state in Nigeria today, and champion of the health sector, General Yakubu Gowon, Your Excellency, the Governor of Delta State, the President of the Nigerian Medical Association, the President of the Commonwealth Medical Association, both outgoing and incoming, past presidents of Nigerian Medical Association, Permanent Secretary, Ministry of Health, directors, medical colleagues, doctors here present. It is my delight to be among you all today, my colleagues, as you commence activities to mark the second National Health Summit of the Nigerian Medical Association and the 25th Triennial Conference of the Commonwealth Medical Association. I welcome all delegates from all parts of Nigeria to this conference, and also particularly welcome the delegates from the Commonwealth and the President and other executive members who are here to participate in the activities of today. For reasons that are obvious, I also welcome the choice of the theme for this summit by the Nigerian Medical Association, which is patient care, patient-centered care, and the patient is, of course, at the center of all healthcare activities in any hospital. His Excellency, the keynote speaker, the Governor of Delta State, gave a very eloquent and cerebral rendition. From his point of view as a clinician, you can see, as a parliamentarian, and as an administrator, you've seen it from three sides. And I do take on board, sir, what you have given us. I also, at this point, also commend the President of the Commonwealth Association, the outgoing and the incoming, for their speeches. Your suggestions and remarks and observations are taken on board. There is no greater measure of the quality of healthcare anywhere than the priority accorded to the patient at every level of treatment at all times. It is no longer just enough for the patient to be assured of accurate diagnosis and treatment of his ailment. He expects and must be accorded full confidentiality and due respect so that patient experience begins to improve in our country. The care of the patient also envisages that a patient must have access to information and education regarding his illness to enable him participate in making informed decisions. That means he must be also kept updated on nature, extent, and possible complications of treatment. In all of this, patient privacy and confidentiality must never be compromised. Patient dignity, even in his most vulnerable state, must thus remain sacrosanct. It also means that the patient deserves a clean, sanitary environment and a civil, respectful attitude of healthcare workers. If we must be honest to ourselves, as we must be, we must admit that even more than lack of equipment and medical technical expertise, poor housekeeping and sanitation, and poor, often disrespectful attitude of hospital staff to patients, and also a perceived lack of confidentiality damage the image of the health system and reputation of the Nigerian hospital, and also the public confidence in it. It does not cost much money to repair that, but a mindset change. And to this, the Medical Association will be requested to partner with the ministry to start re-examining the health system. Because there is no doubt that the loss of confidence in our hospitals is the father of medical tourism. There is no doubt that our health system is in need of review, and particularly that our hospital systems and service provision need some reforms. The sub-themes for this summit are also apt at this time, when we are experiencing migration of medical doctors to pastures some may consider to be greener. The federal government would like to open up a conversation with doctors and nurses to study ways of retaining our skilled workforce trained at great expense to the state, as determined by the Postgraduate Medical College of Nigeria. We still have much need to strengthen our highly specialized human resource for health, for expanded healthcare delivery. The Federal Ministry of Health will work with state and local governments to encourage the creation of a conducive environment for healthcare professionals to practice and thrive. Universal health coverage for Nigeria is a primary target of the administration of President Muhammadu Buhari, and also recognized worldwide as a critical strategy for human capital development to achieve the UN Sustainable Development Goals. Efforts are ongoing to restructure the National Health Insurance Scheme, make it more efficient and effective, and to work with state governments to expand coverage by enrolling more people from the informal sector, including rural population. This is a critical part of the President's promise to lift 100 million people out of poverty within the next 10 years. The federal government also wishes to see an end to interprofessional disharmony in the health sector, a real cause of concern to society and end users, which are the patients in our hospitals. I am pleased to note the invitation extended to other members of the healthcare delivery family and the steps taken to bring this subject up for discussion at this meeting. This is a mature approach to leadership for which I wish to commend here quite openly the executive of the Nigerian Medical Association. We hope this coming together will be the beginning of better relationship for the benefit of Nigerian patients. The start of implementation of the National Health Act and the provision of 1% of Consolidated Revenue Fund for basic healthcare provision is a signal of the President's determination to address the challenges of our healthcare delivery system from the root cause. This fund will provide essential medical services to the poor and vulnerable Nigerians who seem to have been left behind in social service delivery for decades. It is from their environment that the horrific health indices that embarrass us all are generated. We intend to ensure that the funds are used for the intended purpose to achieve the intended targets. The Diaspora Healthcare Initiative is another program the government is testing in order to scale up capacity of the healthcare workforce by the transfer and exchange of cutting-edge knowledge and skills, and also patient management expertise of Nigerian diaspora workforce to their colleagues at home. Many developing countries do this to acquire global best practices, and we believe such interaction will build capacity and impact on the provision of care to our patients. Nigeria's health human resources needs are real. We have a situation where human resource experts trained and skilled at great cost to the nation, estimated also by the Nigeria Postgraduate Medical College as up to 70 million per fellow, are lost to our health system by migration to already developed countries. This is worrisome to stakeholders in the health sector, and we welcome practical suggestions to finding solutions to this problem. I believe this meeting should include discussions on this subject. The government of Nigeria invites the Nigerian Medical Association and all healthcare professionals to continue to seek innovative ways of solving healthcare challenges. I again refer to the very enlightening speech of the outgone president of the Commonwealth Medical Association, who dwelt on this topic in relation to digital health. We shall support all efforts to improve the health indices of our country. It is definitely worthwhile to remind all of us that we are health professionals, and as custodians of the health and well-being of Nigerians, are a very valuable segment of Nigeria's human resource assets, and must therefore be each other's keepers. To avoid burnout and enhance capacity to perform optimally, we must take a keen interest in our own personal health and well-being. Only fit, healthy, and productive physicians can render useful service to society. I now wish to congratulate the Medical Association again and the local organizing committee for so ably hosting the Commonwealth Medical Association, and again to congratulate the incoming president, and also thank the past presidents of the association. This is a very proud moment for us Nigerians. Finally, I pay tribute to the past presidents, the denizens of Nigerian Medical Association who are present here today and those who could not come, and thank you for your past services to our country. I commend again the NMA for helping to set this agenda for health. Leadership is not about taking care of one's personal interests, but about seeking the common good of all our people. I am privileged and honored to be standing in for His Excellency, the President of the Federal Republic, and on behalf of the President of the Federal Republic, I now hereby declare the second NMA National Health Summit and the 25th Triennial Conference of the Commonwealth Association open, and wish you fruitful deliberations.
Another round of applause for the special guest of honor, President Muhammadu Buhari, here represented by the Honorable Minister of Health, Dr. Usagi Ehanire, delivering his remarks and thereafter declaring the second National Health Summit open. Please be seated. Next will be a presentation of awards and plaques by the President of the Nigerian Medical Association, Dr. Francis Faduile, to some of the dignitaries here present. First will be His Excellency, President Muhammadu Buhari, here represented by the Honorable Minister of Health. Thereafter, we would have the chairman of today's occasion.
Okay. You heard the Minister of Health there, Dr. Osage Ehanire, representing the President and Commander-in-Chief, President Muhammadu Buhari, at this auspicious occasion. We've seen the investiture of Dr. Osahon Enabulele as the first Nigerian ever to occupy the seat of the President of the Commonwealth Medical Association. The NMA, as the professional association for Nigerian dentists, doctors and dentists, has a series of functions, part of which is to assist the government and the Nigerian populace in the provision of efficient and affordable healthcare system. It has once again embarked on the arduous task of catalyzing the much-needed changes in the healthcare delivery sector with the overall positive impact on national development.
And the President of the Federal Republic of Nigeria. Thank you very much.
There's another one for you. I'll go that way.
And this is to you, sir, as the Honorable Minister of Health. Thank you for your marvelous representation of the microphone.
All right, may we respectfully invite His Excellency, the former Head of State and Chairman of this occasion, Dr. Yakubu Gowon. Once again, be reminded his doctorate is in political science and not in medicine. Always.
Your Excellency, this is the second time we are calling you, and I think NMA has a constitutional provision to make you a fellow doctor, so that we can induct you into a medical doctor, but we will not give you ability to have the syringe to use.
So that I can deal with you.
So, on behalf of the Nigerian Medical Association, I present this award to you for being the chairman of the second National Health Summit and being able to associate with us in our application. Thank you very much. Congratulations.
Thank you very much indeed. Thank you very much indeed. I appreciate you. Yes. Sorry. I appreciate you. I appreciate the Medical Association. Thank you. Well done. Yes. Thank you.
Next will be His Excellency Engineer Abdullahi Sule, Executive Governor of Nasarawa State, and one of the chief hosts for this summit. Engineer Sule.
How would
you just hold it and tell him you give him, just tell him, just tell him and send it to him.
Your Excellency, sir, on behalf of Nigerian Medical Association, I want to appreciate you, especially for your interest in making sure that health is priority in Nasarawa State, and also showing a great support towards the second National Health Summit. We know that with a doctor as a deputy, the sky is just going to be the beginning. Thank you very much for being here and supporting us as a Coast Chief Host. Thank you very much, sir.
Can I have it, sir? I'll take it for you. Thank you so much.
All right. For this set of presentations, last but not the least, may we respectfully invite our keynote speaker at this summit, the Executive Governor of Delta State, distinguished Senator Dr. Ifeanyi Okowa, former Secretary of a local government, former Chairman of a local government, former Secretary to the State Government, and former Senator, always a Senator, incumbent Governor of Delta State, and thereafter, what next, Your Excellency?
Well, I want to thank Senator Okowa for being gracious to have broken one of his rules when we gave him the tie and the tie. He said he's not wearing suit as usual uniform, but today you can see he's a true doctor. He has dressed up and adorned fully as a medical doctor, and it shows that the profession is richly blessed. And as we have seen, his giant strides in Delta State is second to none in terms of contributory health insurance and the NHIS. And on this, I have the singular honor to present this award to His Excellency, Dr. Ifeanyi Okowa, as the guest lecturer and as the chief financier of this second National Health Summit. Thank you very much, and may God continue to bless you. Thank you, sir. Sorry, can I call the past presidents? Past President Dr. Osagai. The past presidents, in appreciation of one of the good works of a fellow past president, which I hope to join very soon, they have a very small gift for Dr. Osahon Enabulele.
Let's wait.
Sir, can you present?
Yeah, it's a moment for recognizing hard work and excellence, and it's about giving honor to whom honor is due. We've seen some dignitaries who had made positive impact on the health profession, both within and outside the country. We've just been honored, and it's a moment of joy for a lot of them, and a motivation for others to follow suit. The medical profession is one of humanity, of love and care, and the NMA has once again set the agenda for others to key into that will take us to a better healthcare delivery, just like we saw during the maiden edition of this National Health Summit, which held in Asaba, the Delta State capital, in 2013.
There will be a photo session after the next item, which is a vote of thanks. May I therefore, cameraman, please out in the meantime. After the vote of thanks, we will have a photo session with the dignitaries who are here present, and according to the organizers, all those who are occupying the front row will step forward for a group photograph to be accompanied by members of the National Officers Council and the local organizing committee of the Nigerian Medical Association. But let me invite Honorable Tanko Sununu, who is here wearing two hats. He's a medical doctor and immediate past Secretary General of the Nigerian Medical Association, and also on this occasion, standing in for the Right Honorable Speaker of the House of Representatives. He will now step forward. Now we understand that, all right, well, I can get a signal from him that vote of thanks, you're not the one supposed to give that. All right, so the organizers, they will return to you. Okay, coming forward now will be the incumbent Secretary General, Dr. Olumiwa Odushote, to give the vote of thanks.
Chairman of the occasion, His Excellency General Yakubu Gowon, the special guest of honor, President and Commander-in-Chief of the Federal Republic of Nigeria, ably represented by the Honorable Minister for Health, His Excellencies, the Governor of Delta State, His Excellency the Governor of Nasarawa State, the Speaker of the House of Representatives, ably represented by the Chairman, House Committee on Healthcare Services, the Secretary of the Government of the Federation, ably represented, the Head of Service of the Federation, ably represented, the former Minister of Health, the Royal Fathers of today, the President of the Commonwealth Medical Association, the President of the Nigerian Medical Association, Chairman Committee of CMDs, heads of extra-ministerial agencies, heads of affiliates of the Nigerian Medical Association,
state chairmen here present, delegates, partners, sponsors, distinguished ladies and before I give the vote of thanks, let me specially recognize in our midst the Permanent Secretary, Ministry of Health, Mr. Abdullah Aziz Mashi Abdullahi, who had been here. We recognize you. We appreciate all your support, and we will continue to work with the Ministry of Health to ensure that the health sector in Nigeria is lifted to the next level. We also recognize all directors of the Federal Ministry of Health here present. Once again, I'd like to apologize to the following people, particularly the Chairman Health Committee on Health Services, representing the Speaker of the House of Representatives, who was earlier on lined up to give a goodwill message, but due to the exigencies of time and the pressures thereof, this couldn't take place until now. Also, the President of the National Postgraduate Medical College of Nigeria, the Chairman Committee of CMDs, and the President of the Association of Nigerian Physicians in America. We want to express our deep apologies for our inability to take your goodwill messages. We are well aware that you mean very well for us. You have supported us up to now, and we are counting on your continuous support going forward. Let me also recognize the presence of Comrade Hussaini Amisu, the Vice President of the Medical Health Workers Union of Nigeria, here representing the President of the Medical Health Workers Union of Nigeria. We appreciate your presence. I want to thank everybody for making this occasion quite memorable. It has been a very worthwhile event. And we are hopeful that just like the first National Health Summit produced a deliverable that all Nigerians are feeling today, we believe that by the end of the day, that this summit will come out with a deliverable that will reach every Nigerian in every nook and corners. And that will only happen because all of us here were able to make it here, and our contributions will make the difference. So we want to express our profound gratitude on behalf of the President of the Nigerian Medical Association and all the organizers of this event. We appreciate you all, and we are looking forward to continue in this progressive work to getting Nigerian health system in the place where it ought to be. We are the giant of Africa, and giants in Nigeria are here present. We appreciate your efforts, your contributions, and I want to pray that the Almighty, who had brought you here safely, will also take every one of us back to our various destinations safely. Distinguished ladies and gentlemen, it is my pleasure to leave you in the hands of the Almighty God as we continue to struggle to improve the health sector. Thank you. God bless.
Your Excellencies, distinguished guests, ladies and gentlemen, may I now respectfully invite the dignitaries who are seated on the front row to please come up here for a group photograph. And behind them will be the members of the National Officers Council and the local organizing committee of the Nigerian Medical Association. Your Excellencies and distinguished guests, please. So the cameraman, get yourself ready. We'll take that very briskly.
You've been watching the live telecast of the second edition of the National Health Summit of the Nigerian Medical Association and the 25th Triennial Conference of the Commonwealth Medical Association, holding here at the International Conference Center in Abuja, the nation's capital city. You've heard it all. It's the dawn of a new era where the NMA had once again set the agenda, this time around, for patient-centered care, which it expects all tiers of government and followers as well to key into, so that Nigerians can enjoy better health care and be treated the way patients should be treated. It's on this note that I, Rabi Abdullah, on behalf of the OB crew here at the ICC, thanking you for investing your time with us as we return you to regular programming. Thank you for watching.
Imagine a station where you access information. Think of a station that creates awareness for national development. Imagine a station that prepares you for a bright and greater future. A station for all ages. Documentaries, classroom and television, events coverage, children's programs and variety shows. Always stay tuned to NTA Knowledge on the Star Times platform, channel 359. For partnership, sponsorship and advert placements, contact us on NTA Knowledge. NTA Knowledge, learning to broaden horizon.
Everyone likes a good meal, especially if it is prepared with fresh fish, such as those from the fresh waters of Ekpe. This is Ekpe, a town located on longitude 4 east and latitude 6.31 north, and approximately about 89 kilometers from Lagos. Ekpe presents a picturesque setting with its location on a slightly elevated land ranging between 30 to 60 meters above sea level. Ekpe is a riverine town with its waters bounded by thick mangrove swamp. Therefore, the occupations of the people traditionally include fishing, farming, carving, weaving, canoe building, fishnet, and fish trap making. However, like any other riverine community in Nigeria, fishing and fishing activities remain at top of the pack. It has assumed a prime importance and an industry that has become a symbol of civic pride to the people of Ekpe. It is therefore no exaggeration to assert that Ekpe remains the fish empire of Lagos State. The uniqueness of the people to perpetuate their traditional way of life is reflected through their organized approach in matters of fishing. Most times, it is family business, integrating entire members. Irrespective of scale, whether from a traditional subsistent level, using paddled canoes, to bigger boats using outboard engines, or to a large-scale dragnet system, the fishes are now at the mercy of the fishermen. Through cooperatives and other organized associations, many fishermen have been able to weather the storm. There is a customary practice by which middlemen are engaged to meet the fishermen on high seas and buy off their catch. They then resell to other big-time buyers at the beachfronts, who in turn sell to the market women. Like in gold, to dig for a good catch of fish depends on how far you can dig. Big fishes do not stay in shallow waters, and the type of fish also depends on the nature of the water.
fish stay according to the size and the water. A small fish will never come to a shallow area, whereby if you want a big fish, you will go deep, you will go far to the shore.
Using different materials, patterns and methods, various types of fish are caught in Ekpe waters for your delight. From the traditional net throwing system to the bamboo pipe tubes or the multi-hook system, the people's creative ingenuity cannot be underestimated. How impressive that a vegetation such as this is actually a ruse for fish to house themselves. And no sooner would they be hauled into raffia-made fish traps planted strategically round the mound. At a point, however, the seeming good fortune of fishermen have to come to an end. This is the off-season, when there are less fishes in the river. In some parts of the world, when the off-season comes, most fishermen remain idle and have to wait until another fishing season commences. But this is not the case in Ekpe. This is because most fishermen in Ekpe also undertake artificial fish farming through construction of ponds, which are located not too far from the river. Why would most fishermen also own ponds?
The time of off-season in lagoon, so this one is certain. That of the river is uncertain. It's under perhaps. But this one, if you got it, you get pond, you introduce stock, you feed, so it will not disappoint you at all. You just need money, you come there, you come and take it. It's just like bank.
Fish farming in Ekpe has therefore been on a steady growth. In this serene, quiet and natural setting are many fish ponds which are providing steady source of income for the fishermen. The ponds are over 400 in number, dotted along the coastline, with catfish being the dominant breed. Combined with deep-sea fishing, little wonder that there are fishes at every corner in this market at Ekpe. Next time you visit Ekpe, be at liberty to walk straight to the beach area to have a feast of the rich variety of fish that Ekpe has to offer. Even when your visit is at a time when fishermen have to return in frustration from sea without any catch, do not worry. There must always be enough fish to eat at Ekpe.
Information is power. Everyone wants power. So feel powerful with the NTA News mobile app, the one-stop information center. Real news at your fingertip. Be the first to report by uploading first-hand information on the U-Report link. And be the first to know by simply clicking on any of the links on the sidebar for headlines, domestic and foreign news, economy, security, politics, sports, and more. Stream live on your smartphone and tablets and stay connected. It's pretty easy. Simply download NTA News app from your Google Play Store and you're good to go. NTA News app, your access to real-time information.